Hi, it's Turan.
Today, we're going to focus a little deeper in the medical segment, and we're going to go around prescription medication. One of the things I'd like to do is first remove the stigma around having and storing pharmaceuticals, prescription medication. A quick search, we don't need to show but one, but there's many links in PubMed and et cetera of safety and efficacy studies showing that 90+% of the top 100 medications are actually shelf stable for more than 10 years. So,
But my medication expires in 6 weeks.
I don't want to get into why there's a manufacturer expiration date. And please do your own due diligence, check your specific medication and making sure it does have, but you have a 90 plus.
For the most part, the expiration or these deadlines, they don't have to do with the medication turning into something that poisonous.
Yeah.
It's about reduced efficacy.
Efficacy, yeah.
So at worst, it's a little less effective, but these medications can last for much longer.
Yeah. The stability testing is only done for so many years when you're in pharma, but third-party testing has tested older medication, and that's why those analyses are available. Do a quick PubMed search. So our goal always in our approach to preparedness from our family to yours is having some depth and having some breadth in case, like we have been in medical emergencies and situations not being able to get help. So we just covered, when you have medication, check for yourself. If you don't finish it, which you probably should have, but if you have extra medication, keep it. As well as keep the information that came with it, when to use it, how to use it, because it'll be a little deeper than what's on the bottle. And if you're not sure, you can look it up and fill it off.
Yeah, we can research it. We have articles, generically speaking. If you want some more clinical advice, there are books, there are mini guides that have much more chemical drug counter interaction. There are a lot of resources, and you can study online, find a lot of materials as well.
We take some family vacations. We take a lot of road trips now. Turan and I have both been road warriors traveling. When we travel with our families, we each made the choice, and we've had the unfortunate events where we needed medications that we didn't already have on hand.
And by the way, it could be as simple as your kid has diarrhea and you're 10 miles from the nearest emergency center, or you're camping and someone needs a little more immediate attention. It's not always about the end of the world.
It's not. So what we've done, and we've worked with a number of different organizations, here's but two of them, that actually offer a virtual meeting. You speak to them on the phone, you do an intake question, and then with a physician, and then they'll actually, you can purchase a medical kit from a licensed organization to send you true pharmaceutical products as your backup medical kit when and if you face one of the conditions that you can't get help in time. It's not on the way. Doesn't have to be a cataclysmic emergency that roads closed and that there's a tornado or storm. It can also be that you're traveling, it's a holiday weekend, you're out of range, and the scenarios continue.
And maybe if you're a little more advanced level, then you're keeping track of the medications that you have kind of a running inventory, and you're looking at expiration dates and giving them more grace than necessarily what's on them. But if you have a certain med that is now 4 or 5 years old and you want to replenish it, then you keep track of it. So it's really like all of the visitors to our site. You have folks who are very early into the prep readiness, and we have folks who are very organized and want to have lists. So these are great tips for them to follow.
So again, we're exposing you to ideas. Please, if you have additional questions, please reach out to us at bepreparedsolutions.co. As Turan mentioned earlier, check out some of our articles. And then we have a depth and breadth of kits that we've actually curated for medical emergencies, trauma, and just over-the-counter products that could help you and yours in a pinch.
I believe you should stay safe and be happy. So be prepared.
Thank you.
Thank you.